Prednisone, also known as the trade name Deltazone. The pharmaceutical is glucocorticoids, and the therapeutic is an anti-inflammatory, also an immune modifier. The action is that the it reduces immune inflammation and normalizes immune response. The route is PO. The indication is for patients with allergies and autoimmune immunity. The assessment, what we're going to assess for is going to go I's and O's, daily weights, as well as we're going to assess for vitals. We're going to do blood pressure, pulse, and respiratory rate. We're also going to assess for adrenal insignificancy, as well as we're going to assess for GI upset. We're going to assess for muscle weakness, as well as muscle spasms. For the lab, we're going to assess for electrolytes, and we're also going to assess for glucose. For patients with diabetes, it may cause a hyperglycemia, which is an increase of glucose. For patient education, we want to tell patient to take medication as prescribed, or until the last dose, depending on why the patient is taking this medication. We want to advise the patient not to get any vaccines, or notify the doctor of what type of vaccine they're going to get, particular to the live vaccine. It's not really recommended to take vaccines with this medication, but just to make sure it's safe, notify the healthcare provider. We're also going to educate the patient about any abdominal discomfort, such as GI irritation, black tarry stool, GI bleeds, or anything like that. Go ahead and notify the doctor. Avoid alcohol and CNS depressants with this medication. You want to avoid driving until known of meds, because it can cause dizzy and drowsy.